How to deal when the world gets canceled. In the midst of this unprecedented situation, it is helpful to think about why our lives are so disrupted, and why everything that gave us a sense of normalcy seems to have been canceled. In short, it's because we're doing the right thing. We're doing the compassionate thing, no matter the cost. We're doing the only thing that has a fighting chance of slowing the spread of the virus, increasing the rates of survival, especially among those most at risk of dying from COVID-19, and reducing the chances that our healthcare system and the heroes who staff it will be completely overwhelmed. The why gives us meaning, as it makes us all part of an enormous, sacrificial, coordinated act of compassion, especially toward the most vulnerable. Before we get into how to deal, let's take a look at the likely psychological effects of all of this. Not surprisingly, people do react very differently to the stresses of distancing, social isolation, and uncertainty. Some decidedly introverted types are doing very well in finding the enforced distance from the office or social gatherings refreshing and not at all distressing. But most of us will have some distress in the midst of this. In previous outbreaks that resulted in quarantines on a much smaller scale, research has shown that post-traumatic stress disorder symptoms often emerged. For example, irritability, anger, and hypervigilance, which is just being on high alert and scanning for danger at all times. This is worth talking about because it's very normal and healthy for us to be anxious and hypervigilant during times of danger such as this. That's part of the mechanism that helps us survive in an uncertain and perilous world. But it is also exhausting when the hypervigilance never stops, and that exhaustion can lead to other physical and mental health effects like insomnia, substance use, and lowered immune functioning, which is not something we ever want, but especially not now. If we become depressed, that can make it hard for us to enjoy the things we normally do, including things we usually love to do at home, whether it's binging Netflix or redecorating a room or sleeping. Prolonged isolation can also lead to distress due to being separated from people who are important to us, who are part of our close social network of support. We can begin to experience confusion, especially in the absence of clear and reliable information, and we can become bored or distressed because of financial uncertainties and disruption, especially in a gig economy where so many have been canceled. But what now? What do we do now that all the things we usually do to cope with the stress of life, like going to restaurants, going to church or other religious events, or getting out to hear live music, going bowling, etc., all instantly and completely unavailable to us? Here are 6 research-based strategies for helping us deal. The first thing has to do with our diet of information and misinformation. This strategy is about putting the brakes on bottomless bad news. We all know that information comes at us hard and fast, and it feels like we're trying to drink from a fire hose at times. But especially with social media such as Facebook, Twitter, and Instagram, the feed is endless. You literally never get to the end of it. And these days, that bottomless feed is filled with ominous, scary, anxiety-provoking information, much of it factually incorrect, which can also make it dangerous. How to deal? Impose limitations on how often you allow yourself to consume information about the pandemic and its effects. For example, it would be much healthier for most people to allow themselves to access their feeds once in the morning and once in the evening, rather than checking in dozens of times a day and never getting a break from the often bad news. Given the mountain of misinformation out there, you should also make sure you're getting your news from reliable sources, such as national news organizations, a respected local news outlet, and importantly, scientific authorities such as the CDC. The second strategy is to recognize that there are crucial differences between social distancing and isolation. Social distancing is maintaining a safe physical distance between yourself and anyone to whom you might transmit the virus, which the CDC says is about 6 feet. Actually, we shouldn't think about this as social distancing at all. The virus isn't transmitted via social means, but physical means, so this is really physical distancing. So that means you can go outside, go for a walk, get some sunshine, while observing precautionary distancing. That is not at all the same as being in isolation, physically or emotionally. If you're sick and symptomatic, physical isolation makes sense in efforts to slow the spread of the virus. But even in those circumstances, there are many ways to stay connected to those we love and to those who love us. What we know for sure from many years of research is that social isolation increases our stress and over time can suppress our immune system. Again, we need all the immune response we can get right now, so it's important to find ways to stay connected. Which brings us to the next strategy. Strategy 3 is to assemble your support squad online. Fortunately, we live in an era where we can bring all of our offline supports online. Well, a lot of them anyway, and fight off the negative health effects of social isolation and loneliness. It's a good idea to simply identify a reasonable number, say 4, 5, 6, of your most important supports, including family, friends, healthcare professionals, therapists, mentors, etc., and develop a plan to stay in touch regularly. You can use Zoom, FaceTime, or just good old-fashioned phone calls to connect. But just make sure you do it regularly, daily, twice a week, once a week, whatever works best for you. Did you know there's even an app now that allows you to sync up your Netflix account with others and have socially distanced binge-watching parties? There is real medicine in being together, even virtually. Number 4. You know how sometimes the only thing you can do to get your computer to work again is to close all your open apps, tabs, and windows and restart the machine? The 4th strategy for making the best of these trying times is kind of like that. Use this as an opportunity to do a system reboot. When normal life gets canceled, it untethers us from all the cues and rituals, routines, and habits that give our lives structure, the ones that keep us behaviorally activated, as psychologists say. Without all those things, we can experience rising anxiety because we don't know what to expect, and we don't have the guideposts of normal routine to keep us on track and activated. We can apply what psychologists call behavioral activation theory to the problem to help us reboot and create a new normal that works for us. How do we do that? Well, there are 4 basic steps, really. Number 1 is keeping track of activities, hour by hour, all day long. Just take a piece of paper and track what you do every day, hour by hour. Second thing, review it at the end of the day and write next to each activity how it made you feel and how intense was the feeling on a scale from 0 to 10. 10 being most intense. Third, from that information, decide what was helpful and what was not for you that day. And the 4th thing is do more of the helpful activities and less of the unhelpful ones. Try to change one thing a day, one of those things every day. So if we do these things, soon we will have a new normal that serves us well and is intentional rather than a mindless routine. Number 5. Another strategy and an important part of the reboot of our lives is to achieve mastery of something. Few things nourish our souls and give us a sense of control over our world like tackling a challenge and mastering it. So find something that excites, engages, and absorbs you. Find something that you get better at the more you do it, the more you work at it. You probably have a mastery project or 2 in mind already. That thing about which you've always thought, someday I'd love to learn to, well, someday is here. So read War and Peace, or whichever of the great books you've always wanted to tackle. Take on an online course. There are a lot of them available for free these days. Learn to play 5 Beatles songs on guitar all the way through, perfectly. Or very well anyway. How about finally organizing all the physical and digital photos from the past decade that you've been meaning to get to? How about developing a bodybuilding regimen? You get the idea. Mastery is great for our mental and physical health. The 6th and last strategy I want to suggest is to cultivate and show compassion. We find ourselves in a new world few could have envisioned only a few weeks ago, facing challenges we've never seen before. The closest thing might be the Spanish flu outbreak of over 100 years ago. But both the challenges and opportunities are even greater now with globalization, instant communications, and the glut of information and misinformation upon us. As mentioned before, it's helpful to think of everything that's being done, all the inconvenience, the hardships, the economic impact, as a coordinated act of compassion for those we love and those we don't even know. This gives us the very real sense that, in truth, we really are in this together. That is how we will get through this and emerge on the other side with new dreams, new visions, and new ways of being in the world. It is up to us to put into place the pillars of compassion for ourselves and others right now. It is up to us to remain open-hearted and to look for, take note of, and share all the things for which we are grateful. Most of all, each other. Every storm eventually runs out of rain. Every red light turns green. We will get through this. Together.